Greetings, I'm Linda Freed, and it's an honor to join you here today. I'm joined by John Wong, and we are here representing the National Academy of Medicine's Global Commission's report on a global roadmap for healthy longevity. I am honored to be here with you today to report on the Commission's recognition of the tremendous opportunities ahead of us if, as a world, we seize them for building from the tremendous demographic change that we are experiencing to really seize its opportunities. As this audience knows well, there have been 100 years of transformation of the demography of countries and of our world. Here you see that by 2050, 18% of the global population will be 65 and older, while at the same time fertility is declining and the proportion of those young, in this case under 5, will decline to only 6% of the global population by 2050. These transformations are leading, as you can see in the population pyramids at the bottom of this slide, to almost equal proportions of people of different ages from the youngest to the oldest. This demographic change has tremendous impacts, and it stands to fundamentally impact every country in terms of how families, communities, societies, industries, and economies function, and how we actually build for societies of longer lives that bring out the opportunity is critical. The Commission defined healthy longevity as the goal for bringing out the opportunities, where healthy longevity is the state in which years in good health approach the biological lifespan with physical, cognitive, and social well-being across populations. The importance of healthy longevity as a goal is tremendous. It, of course, is about living healthier and more productive lives for all ages, not just older people, because achieving it requires a life course approach of investing in health at the youngest of ages and at each subsequent age to accumulate the opportunity for good health in the oldest ages. Healthy longevity, if achieved, can be characterized by learning and growth, as well as health, diverse and satisfying intergenerational relationships, the opportunity with health to engage in productive and rewarding activities, and the development of work and societal roles that have meaning and purpose for older people. Making these investments will result in a longevity dividend if longer lives and good health are combined with the structures needed to enable healthier older adults to be productively engaged in life. Society and individuals of all ages will benefit. This commission was charged with preparing for how we socially, scientifically, and financially need to transform and invest for longer lifespans, and builds on a wide body of work globally, and some of those reports are detailed here. And we were challenged by the National Academy of Medicine to address the challenges and identify the opportunities of global population aging, to recognize how to catalyze change to promote healthy longevity and generate transformative and scalable innovations worldwide, to bring people from all sectors together as to achieve the promise of healthy longevity. The National Academy commissioned a global body of experts to produce an evidence-based consensus study providing the strategies to achieve healthy longevity. An international oversight board, global in representation, provided oversight for the design, charge, and implementation of the report. And the report itself was carried out by a commission, which I have had the opportunity to co-chair along with John Wong from the National University of Singapore, and immensely expert colleagues globally from multiple countries and 4 regions of the world. The statement of task was to lay out the basis for strengthening communities and enriching the lives of older people, exploring and recommending the approaches to enhancing systems across society, identifying approaches and reforms, avenues for innovative age-related research, and building on existing reports and global initiatives. It's important to say that the status quo represents a high cost of inaction. We already have people living longer lives with ill health. The GDP is clearly lower than it would be with better health through longer lives and full inclusion of older people benefiting from the assets that they can and would like to contribute. The costs of inaction involve increased fiscal burdens on government because of more people living longer with ill health, and increased fiscal financial burdens on individuals and families, and most of all, the lost opportunity for people of all ages by not recognizing, valuing, or including the tremendous capabilities and abilities to contribute that people of older age desire. So I'd like to speak first to the vision of the Commission for Healthy Longevity. As I said, the Commission defined healthy longevity as the state in which years in good health and the biological lifespan approach the biological lifespan with physical, cognitive, and social functioning, enabling well-being across populations. The Commission sought to actually build on the evidence that we now see that health span can be extended to approximate our longer lives, that prevention works and matters, that health is generated through every sector of society, and if unified, this can be accomplished for everyone. The evidence that all generations can benefit when the barriers to older people's full participation are eliminated, and that there is clear evidence for a return on investment of substantial proportion from investments in new types of social, physical, and health infrastructure that can improve health at all ages and enable older people to continue to contribute into their oldest ages in ways they value. And this evidence actually disproves many myths that our policies and practices are currently based on. One, for example, is the myth that jobs for older people eliminate jobs for young people. But in fact, workforce participation among older people is positively correlated with workforce participation among the young. And beyond that, intergenerational teams have been found to be more productive and innovative. Based on all of this evidence, the Commission chose an approach to creating a vision that starts with the endpoint. If we built from the evidence in 2015, far enough away in the future to see tremendous change and close enough to be relevant, particularly for people in their early 20s who will be entering older age by 2050, what could we create by 2050 using the evidence of what's possible? Well, the Commission has created a vision of a society in which all people are enabled to have long lives with health and function, in which with health, older people have the full opportunity to engage in meaningful and productive activities that meet their goals and bring their social capital to society, in which all of society benefits from the contributions of older adults, and in which when older people are thriving, all ages thrive. And finally, a society in 2050 in which we have accomplished the resolution of health disparities and accomplished the creation of equity within and between countries. So the vision is anchored in the evidence of what's possible and based on principles for healthy longevity, that people of all ages can reach their full potential, that societies that will permit this will be enabling the best health and functioning that individuals at each and all age are capable of attaining, and that we have accomplished an end of disparities between groups in the opportunity for healthy longevity, and unleashed the human, financial, and social capital of older people, which can be realized for their benefit and will benefit all of society. And finally, that we join together as a globe to create data and meaningful metrics to track the achievement of these goals. The Commission envisions accomplishing this through investing in a virtuous cycle where healthy longevity increases human, social, and financial capital, and the fruition of human goals at different ages. This provides and unleashes the resources to support investing further in the enablers of healthy longevity, which in turn go on to further amplify healthy longevity. Equity and social cohesion are at the center of this as the social compact of this virtuous cycle. And the resources unleashed through human, social, and financial capital are able to resolve the disruptors that prevent realizing this vision. The strategies are to shift the multiple complex systems of a society. All sectors need to make parallel investments in order to accomplish a society that realizes Vision 2050. This commission has provided that vision in its detailed report, but also identifies key levers that can initiate implementation, create optimism, momentum, and early returns, and assure that an all-of-society transformation is begun to build toward Vision 2050 for societies of long lives with health. The relevant actors are basically all of us across all sectors. The commission identified 4 domains that need to be focused on to realize this vision. 3 enablers: redesign of the social infrastructure, the physical environment, and health systems, and the return on investment found through enabling older people to continue to engage in work, to contribute through volunteering, and to grow through education and lifelong training, to create the return on investment for societies as well as individuals, which we see as a longevity dividend. So let me continue by talking about the longevity dividend. And I'd like to start first by talking about the economic contributions of older adults at the present, because older adults already make significant economic contributions, contrary to the narrative that we have about what it means to grow old. These are data from work by David Bloom and colleagues published in 2020, which showed that even at the present, contributions by people 60 and older, here data from the US on the left and the European Union on the right, show that across contributions for those 60 and older through market labor in the top orange, volunteering in the gray, support for non-household members in the bottom orange, and caring for grandchildren, that both the market-based contributions through pay for work and the non-market-based contributions through these other roles are the equivalent of 7% of the GDP in the US and 8% of the GDP in Europe. So already substantial contributions, but large rooms for growth that could match the goals that older adults themselves have. We've also learned that there are challenges for many in meeting those goals. Workers in poor health are more likely than their healthier counterparts to transition out of work and into retirement. And in high-income countries, many people are not able to obtain work, need to work more years to support their longer lives. Sometimes that comes from inability to be hired, and sometimes that comes from ill health, their inability to be working. Age discrimination is a large force in all of this. And of course, at the same time, we know that older workers are increasingly valued in the workplace. We know that in informal and gig economies, both in high and middle income countries and dominantly in low income countries, that workers in these sectors lack social and financial protections. We also know that labor force participation in low and middle income countries is considered to be too high because people lack the resources to stop working. And in contrast, labor force participation in high income countries is unsustainably low. So seeking to create healthy longevity focus on heavily will really unlock the opportunity to rebalance the ways in which older people can engage in the future. Through work, as well as retirement, through volunteering, and through really redesigning education and retraining to extend across our now longer lives. The goals for 2050 are to arrive at unleashing the economic and social benefits generated by people living, working, volunteering, and engaging longer, and to have the social infrastructure, institutions, and business systems that enable safe and meaningful work and other community engagement at every stage of life, and the education and training opportunities that promote participation in lifelong learning, growth, and engagement. The benefits to workplace and society from remaining in the workforce are tremendous. Obviously, income generation for older adults, potential health benefits from staying active, a strengthened economy, a strengthened workforce and workplace. The recommendations to initiate this from the Commission in the first 5 years through 2027 are that governments in collaboration with the business sector should design work environments and develop new policies that enable and encourage older adults to remain in the workforce longer, and create incentives to recruit and retain older workforce so as to increase workforce participation when that is desired. The supporting structures will require governments, employers, and educational institutions to redesign education systems to support lifelong learning and training, and also to invest in the science of learning and training for middle-aged and older adults. And at the same time, to expand access to secondary education, vocational training, and higher education so as to train and upskill workers of all ages. At the same time, the Commission recognizes that as people get older, their desire to be of benefit to their families, to generations that follow them, are part of the central pro-social goals of older people. And that volunteering offers a vehicle for contributing, giving, and passing on, which enables recognition of older people as contributing citizens and as individuals with self-worth, significance, and meaning. Volunteering meets societal needs when the roles are well designed, but also meets basic psychological needs of older age, of self-esteem and life satisfaction from contributing to others. Formal volunteering in later life, we now know, supports healthy longevity, creates health while enhancing an older person's sense of having contributed to the future. Increased older adult participation in the paid workforce and volunteer roles are critical in an aging society. Critical that we build them, critical that we enable them to make a difference, to maintain just both opportunities for individual engagement, enhance healthy longevity, and create a new societal economic equilibrium in the face of population aging. I'd now like to turn to the other pillar of enablers. And I will start with talking about social infrastructure. What is recognized, of course, in globally is that the social determinants of health contribute to, along with the built and physical environment and public health, create about 80% of the health in a society. So health is actually, and poor health outcomes are heavily societally determined. And the distribution of resources to invest in human capital and build social capital are the programs, policies, and structures that do that are essential to creating health and the opportunity for healthy longevity across the life course. Through policies that protect against poverty, create social and economic inclusion, and particularly that address the issues from this report for older adults, in which we recognize the pro-social goals and strengths of older people, which I already spoke to, the desire to leave the world better than they found it and to contribute to their community. The ability to do that, as well as to work for pay, is constrained deeply by ageism and age discrimination, which constrains social inclusion. Other issues that are key targets for this commission, for us collectively to address for the future, is accomplishing financial security in retirement for all older people, and the creation of digital literacy as well as access. Broad goals for 2050 include social cohesion augmented by intergenerational cohesions and the creation of opportunities for purposeful engagement by older people at the family, community, and societal levels. And at the same time, assuring social protections and financial security for all older adults to mitigate the effects of financial vulnerability at older ages and to resolve inequity. To that end, the commission made recommendations for the next 5 years in terms of building social infrastructure. That government should develop evidence-based strategies for reducing ageism against any age group. That by 2027, all governments should develop plans for ensuring financial security for older people. And that to improve financial security in retirement, governments and employers should develop strategies for increasing financial literacy and mechanisms for promoting a life course approach to pension contributions and lifelong savings. Social infrastructure, the missed opportunities from not having the right social infrastructure for our longer lives involves tremendous costs. The World Health Organization has said that ageism costs all countries billions annually, that the lack of social protections and financial security undermine health and longevity. And as one example, a consequence of ageism and our current social infrastructure is social isolation, which itself in the US increases Medicare spending by an estimated US $7 billion. If we make investments in the social infrastructure that could underpin a successful aging society, we would have pension and social protection systems for all older people, which would serve both to reduce poverty and inequality, enable contributions by older people in other dimensions, and reinforce social cohesion. This kind of social engagement, as I said, is associated with better physical and mental health, but it is critical as well to the virtuous cycle of resolving ageism by enabling older people to be seen as important members of and contributors to society. The supporting structures that need to be built starting now to accomplish Vision 2050 will include laws and policies to eliminate age-based discrimination, Public information campaigns promoting the value of older people and attacking stereotypes so that we can see the tremendous assets and value and capabilities and abilities that older people want to bring to society and are able to do. To develop multi-generational advocacy that fights age discrimination for all ages so we can better accomplish our shared goals. And multi-generational policies and actions to strengthen social cohesion, and in large part through engaging older adults in societal roles, which will also serve to reduce loneliness. Essential supporting structures include pension and social protection systems that include all older adults, including people outside the formal economy, and programs promoting individual savings and financial literacy, as well as access to secure banking systems and investment opportunities. I'll conclude here by introducing Dr. John Wong, my co-chair of the Global Commission that is presenting to you this global roadmap for healthy longevity.
Good morning, good afternoon, and good evening. I will take over from Dr. Freed now and discuss the physical environment as well as public health, health systems, and long-term care. The physical environment affects the way we live, learn, work, and play throughout our life course, for better or for worse. The global ecosystem, the natural environment, the built environment, all impact our activities, local economy, community, and lifestyle, and ultimately our people. Current estimates are that 24% of death and disease can be linked to environmental hazards. This could worsen as more than half of the world now live in urbanized societies. In terms of physical environment, we've identified 6 that we would like to focus on: housing, public spaces and infrastructure, safety, transportation, digital technologies, and the effect of climate change and environmental hazards. And by 2050, we want the physical environment and infrastructure to support a population which is functioning and fully engaged, especially at older ages. Examples of supporting structures over the next 30 years include, very importantly, inclusion of older people in co-design and user-centered design of the built environment. It's not good enough building through the eyes of older people, but actively engaging them and asking them, what do you want? What do you need? Which will allow you to continue doing what you want to do and doing the things that you value. It's very important that public spaces promote social cohesion and intergenerational connection, while also encouraging physical activity. We want the physical environment to enhance access to food, transportation, especially public transportation, social services, and community engagement. And we need to have programs which mitigate the effects of environmental emergencies on older people, especially as the weather becomes more extreme. And very importantly, we must reduce air pollution. And removal of coal burning and fossil fuel forms of energy will be a major step forward. Immediate recommendations over the next 5 years is for the government and the private sector to work together to design with older people a physical environment at multiple levels. At the city level, really trying to see how we can mitigate the effects of climate change and the extremes of weather. At the neighborhood level, really trying to promote both the ability to work, the ability to connect, and the ability to be a multi-generational, cohesive community. At the home level, very importantly, updating the physical infrastructure that we have. It is estimated that most of the housing for 2050 has already been built. So how do we make sure that this housing meets the needs as our populations age? Ensuring that broadband is accessible to really reduce the digital divide, because it's, as this conference can show, the importance of broadband, both in terms of education, health delivery, as well as everything from ordering food and everything else we need to run a 21st century society. And very importantly, public transportation options, because most people use public transportation, and really ensuring that we have first mile and last mile needs met. And this is something which we all believe that these 5 recommendations are immediate recommendations for the next 5 years. In terms of housing, and we've outlined some key targets. So housing, we think it's very important that universal design be available. And so the elements of no step entry, all living space on one floor, very importantly, switches and electrical outlets are at easily reachable heights. You don't have to bend down to plug in something into a PowerPoint, because we know that as people become old and frail, if they bend down, the risk of falls is much higher. Making sure that hallways and doors are wide enough to accommodate wheelchairs, and handles and faucets which are lever rather than having to rotate. Now, unfortunately, the bulk of housing do not have these universal design elements. So how do we retrofit our housing to allow this to happen? Housing must be available and affordable. It must promote health and safety, and it must allow us access to healthy food and other resources. We cannot have food deserts where people just don't have access to healthy food within easy walkable distance. What's the return on investment? Well, a study in 2017 did show that if one provides adequate housing and support, one can reduce emergency room visits and hospital stays, generating a return of investment of US $1.57 for every US $1 spent. A second key target is in public spaces and infrastructure. How do we have sufficient green space? How do we promote walkability? How do we ensure physical safety? And how do we leverage opportunities for the whole community to get together to design what they need to allow healthy longevity? Examples of how this can be successful: community gardens do allow older adults opportunities for exercise as well as social interaction. In Gambia, community gardens created jobs. They empowered women and youth, provided greater food security, nutrition, and health for the participants. In Canada, a study showed that nearly 9,000 neighborhoods in Ontario, Canada, if they were designed for increased walkability, there was a lower prevalence of diabetes and obesity. A third key target is transportation. And as I mentioned earlier, especially public transportation. For people who drive, how do we allow driving to be safe? And now that we're moving into 5G and other forms of, as the digital bandwidth increases, how do we really capture the use of autonomous vehicles and other solutions which are emerging? It's been shown that limited transportation options really limit or impair a person's ability to stay engaged in the community, impedes access to health services, and really impacts negatively on health, especially in isolated neighborhoods. A UK study very interestingly showed that for adults aged 40 to 69, if they switched from commuting with public transport or commuting by active or public transport to commuting by car, there was an increase in body mass index, BMI. And if they switched then from commuting by car back to active or public transportation, they saw decreases in BMI. So providing easily accessible, affordable ways of not driving and still allowing people to get about can improve health. A fourth key area is in digital technologies, and here's where broadband access is so important. Only 15%, 1/5, of the world's population have a fixed broadband subscription. Now, if we do, as we do widen broadband access, it's really important that we look at issues of cybersecurity, privacy, and the user interface. And we really need to try and make sure that we narrow the digital divide between generations, because we do have digital natives. At the same time, we have older populations where digital technology is still something which is foreign to many people. In terms of return on investment, it's been shown that doubling broadband speed can result in an increase of 0.3% increase in in GDP growth. And then the next key target is addressing climate change and environmental hazards. We do know as global temperatures rise, extreme weather events are increasing. We do know that with burning of fossil fuels, air pollution is increasing. And these effects affect basically people at either ends, especially so the very young and the older do bear the brunt of many of these changes. In Frankfurt, in Germany, it's shown that the temperature difference in terms of radiation of heat between a green roof and a black rooftop can be as high as 40 degrees centigrade. In the United States, between 2016 to 2018, it's estimated that 18,000 older adult lives were lost prematurely as a result of air pollution. Now, moving to health systems. We've identified 6 key targets: chronic conditions, public health, healthcare delivery, long-term care, the workforce, the healthcare workforce, and the power of geoscience, technology, and big data innovation. By 2050, we want to see an integrated system cutting across public health, social services, and having the healthcare system be person-centered. And I will go into further detail what we mean by a person-centered healthcare system, as well as long-term care systems designed to extend years of good health and support the needs, the diverse needs of older people. We want to ensure that long-term care systems have both quality as well as they ensure that people receive the care in the setting that they desire for a life of meaning and dignity. The supporting structures required to do this, well, in terms of health systems, again, we really need to integrate public health, healthcare delivery, long-term care, as well as social services. For public health, we need to make sure that we have interventions at both the population as well as the individual level to reduce the risk factors for aging and chronic conditions. We need close collaboration with social services to address the social determinants of health. And we need a robust data analytics system for surveillance, precision public health, and assessment of the efficacy of interventions. In the next 5 years, we recommend investments in public health systems, and this will require rebalancing the investments between healthcare and public health. It does require that policies be put in place to incentivize individuals, employers, as well as communities to engage in prevention and wellness. And we really encourage all countries to establish 5-year targets for preventive health and measure the progress towards these targets. The supporting structures over the next 30 years for healthcare systems, we do want countries to look at having integrated person-centered care, including care coordination. We would like to see much greater investments in primary care systems because the return on investment in primary care is well established. These will provide preventive screenings, address risk factors for chronic diseases, and promote positive health behaviors. We would like to make sure that health records are comprehensive and shared. This will allow a goal-based plan across the entire ecosystem. We want collaboration with social services to address the social determinants of health. And we want to make sure that we have a workforce which is trained in geriatrics that can adequately care for an older population. And then towards the end of life, ensuring that we have palliative and hospice care that allow people to have a life of dignity and comfort in the last phases of their lives. What is meant by person-centered and integrated care? Well, person-centered care is important for all ages, but especially when people have advanced illness or conditions requiring complex management or multiple chronic conditions. And Currently, unfortunately, many people over the age of 50 or 60 have multiple chronic conditions: hypertension, hyperlipidemia, diabetes, osteoarthritis. And for these, clinical guidelines are less helpful because clinical guidelines tend to be disease specific. And actually, treatment efficacy may be controversial because for clinical guidelines for diabetes versus hypertension versus osteoarthritis, uh, um, um, trying to come together and have a comprehensive integrated plan is challenging. Side effects increase the more medication is added, and sometimes treatment for one disease may undermine that for another. So in contrast to a disease-focused care delivery system, person-centered care is relationship-based. It's around the needs of an individual, and it views all their diseases as well as their body systems as interrelated. It's designed around a person's experiences and, very importantly, their preferences and goals. Integrated care really ensures that people receive a continuum of services, starting from health promotion, disease prevention, all the way through to diagnosis, treatment, disease management, rehabilitation, and palliative care at different levels and different sites within the health system. And that it's important to make sure that the care is tailored to the needs throughout the entire life course. So these two concepts of person-centered care, really looking at a holistic approach to people with multiple chronic conditions or people with conditions requiring complex management, and really making sure that it meets the person's long-term needs, as well as integrated care, are two key fundamental concepts of the 21st century health system that we are advocating. So the recommendations over the next 5 years is to really make sure that health systems are affordable, accessible, and culturally appropriate in meeting person-centered integrated care. We want to make sure that there's alignment between healthcare payment and reimbursement systems. We want to make sure that the infrastructure is in place for this integration across different phases of illness, and very importantly, that the data systems are interoperable. We want to make sure that outcomes are based on patient goals and preferences and the importance of patient-reported outcomes. We think that we are really advocating that licensing and certification bodies ensure that all healthcare providers receive training on the pathophysiology and psychology of aging and how it affects diagnosis and treatment as patients age. We need to make sure that the workforce of geriatrically trained healthcare professionals actually increases and not just plateaus or even worst case scenario shrink as the population of older adults with multimorbidity, geriatric syndromes, and declining physical and cognitive function increases. And finally, very importantly, we need to empower all our citizens with the tools and data needed to manage their own health. And this is where the power of technology and governments, employers, and health systems really working together to give these tools and data to individuals so that they can manage their own health. In terms of long-term care, supporting structures over the next 30 years include both policy and funding, prioritizing that care delivery should be in the setting that the person chooses as far as possible, and that this respects individual autonomy and maintains dignity, addressing issues of care quality and the risk of abuse, neglect, and exploitation. We need to make sure that care and social support structures address all needs, including making sure that people have a life of meaning and purpose. We have to support families and family caregivers with long-term care needs. And we need to see how we can harness technology to support caregivers and people needing care by providing monitoring at the same time as addressing privacy issues. So over the next 5 years, in terms of long-term care, we do want to see models in place which are starting to identify pilot programs which allow effective, accessible affordable and scalable programs for delivering long-term care, which meets the needs in the setting, meets the needs of individuals in the setting that they would like. And we need to make sure that we address the needs of caregivers as well as the paid long-term care workforce. In terms of key targets, we would like to address chronic conditions, addressing both biological factors as well as risk factors. We do know the effects of the social and physical environment in terms of diet, physical activity, and substance abuse. We know the effects of tobacco, unhealthy alcohol consumption, an unhealthy diet, as well as physical activity, and the major impact on cardiovascular disease, cancer, chronic obstructive pulmonary disease, and diabetes. We do know that chronic conditions are responsible for 80% of deaths and years of healthy life lost to disability. And the impact is even greater in low-income countries, where their median age of lifespan and health span is lower than in high-income countries. And the global burden of chronic conditions is massive in terms of mental illness in the trillions, diabetes in the billions, cardiovascular disease in the billions, and so on. In terms of public health, we do believe that the health impact pyramid framework is a critical framework for people to keep in mind. So the foundation of the health impact pyramid is on the social impacts, the social determinants of health, issues of education, for instance, housing and transport. Without addressing these, it's very hard to improve public health. Once we've firm policies in place to address social determinants of health, we want to change the context whereby making the healthy choice, the easy choice, is the default option. So how do we nudge populations to improve the exercise, reduce or stop tobacco consumption, and keep alcohol consumption to healthy limits? And then we want to ensure that long-lasting protective interventions like immunization, screening for colon cancer, and then finally, in terms of clinical interventions, medication compliance, especially for chronic disease, and at the apex, individual counseling and education. The return on investments are substantial. In high-income countries, the return on investment can be 14 to 1. And in terms of national initiatives, the median return on investment can be as high as 27 to 1. And WHO lists many cost-effective interventions, including tobacco and alcohol legislation, salt reduction, violence reduction, walking and cycling promotion, green spaces, safe transportation and housing, and healthy employment. In terms of healthcare delivery, we want to make sure that primary care is really reinforced because it's efficient and it allows delivery of high quality, cost-effective care around the world. In terms of geriatric care, we want to make sure that the programs such as the integrated care for older people promoted by WHO is available to all. And we want to make sure that integrated person-centered care is implemented because it is the most effective and appropriate care delivery model for maximizing health, function, and well-being across the life course. In terms of long-term care, we want to ensure that investments are made in community-based long-term care, strengthening the role and really assisting family caregivers, because the quality in family caregiving is highly variable, and the expenditure on family caregiving is substantial. We want to look at how to improve the quality in paid home care and how do we address the challenges that paid caregivers have. We want to address issues in nursing homes where quality is heterogeneous, funding is heterogeneous, and there are real opportunities for change. In terms of the healthcare workforce, we need to make sure that our professional workforce as populations age are adequate and trained to meet not only current, but very importantly, future needs. Medical schools around the world, WHO has shown that the curriculum is wanting, and we really need to invest in making sure that the curriculum, not just in medical school, but across all health professional schools, both in terms of undergraduate, graduate, as well as postgraduate training programs and continuing education programs, meet the needs of our populations. And then finally, issues of geoscience, technology, and big data. Geoscience is an exciting field where our knowledge of the biological mechanisms that cause chronic conditions, frailty, and functional decline are known, and we can start developing both preventive and therapeutic interventions to slow this process, prevent, and even delay the onset of chronic conditions. Technology has been shown that it can improve both functionality as well as increase healthcare delivery and improve health behavior. Telemedicine is an excellent example, and telehealth using wearables, again, are examples of technology. And in terms of big data, analytics, and healthy longevity, artificial intelligence, machine learning really enables precision medicine and precision public health to be done at scale. Technologies such as natural language processing, robotics, computer vision, pattern detection, and fall detection can all improve the health of our population. But there are challenges. There are risks in terms of big data, and we need to make sure that we address issues of statistical noise as well as bias. So thank you very much, and I will then hand over to Linda for questions. Thank you.
Well, thank you for being part of this presentation. And now I'd like to turn on behalf of the National Academy of Medicine report and Dr. Wong and myself to take your questions. And you can submit them into the chat. I have a first question, which I am delighted to address, which is, what do you think are the main actions for healthy aging in developing countries? The Commission would say that across the topics that we have just covered, there are actions in every area that are very important for all countries, developing countries, high, middle, and low-income countries. And I would say that they need to be thought of across the several frameworks. We've talked about specific issues that need and sectors that need transformation for two goals. One is to create health across the full life course so that people who are now arriving at old age will be arriving at old age healthier and will be able to stay healthier. And second, to really design nations and cities and communities for the longer lives we've now created. Most communities were designed when life expectancy was half of what it will be in even 2 decades in all countries. And we need to design for the second half of life to facilitate health in aging for older people, but also to facilitate people staying engaged in ways that they want to and value. So let's think about the sectors. First of all, if we think about the first goal of health across the life course, it's very clear that actually all sectors have a role to play, starting with social protections and social infrastructure, as I discussed earlier, so that we are providing income support so that people are not in poverty, which makes a huge difference in children's opportunity to grow, develop well, be nurtured, and to have adequate food and nutrition, be able to stay in school longer, and actually to grow into people able to engage productively in their lives. All of these conditions set the stage for the opportunity for healthy longevity and are critical parts of whether people arrive at older age with health or in illness. Complementing those social determinants of health, which of course include housing as well, are what Dr. Wong spoke to in terms of public health. The return on investment in public health-led solutions at the level of communities and populations is very high. And its dedication to delivering the conditions that create health for individuals and populations is essential to complement interventions on the social determinants of health. So how, for example, do we design our environments to enable staying physically engaged, to assure access to healthy and nutritious foods? How do we actually develop interventions that promote mental health? All of these things appropriate to every age and stage of life are delivered in large part through effective public health at a community and population level, and in a more targeted way in clinical care. And then, of course, the medical care system and the long-term care system, as Dr. Wong just said, are critical for health and for health in older age. These are the things that set the stage for the accomplishment of healthy longevity. But in addition, with health and with function preserved into older age, it's very clear that across developing and developed countries, that older people desire many things: to have the opportunity to work if they need to, and to stay engaged in their families, supporting the future of young people and the next generations, and supporting the well-being of their communities. In both of those, if we design to enable older people to meet these goals in ways that they value, regardless of the stage of economic development of the country itself, they will be actually supporting their own health and well-being, but also contributing to the vibrancy and thriving of society at large. And I think particularly the goals of older people become increasingly social as we all get older, pro-social actually, in terms of concerns for others, concerns for the well-being of family and community, concerns for future generations. And so programs that can enable older people to come together to support future generations in this way, to accomplish things that no one can accomplish alone, for the betterment of the success of young people, for the betterment of the success of communities, will actually be one of the many ways that older people contribute and that we as societies will thrive because there are more older people. It's important to recognize that as people get older, we accrue capabilities that are a product of acquired both objective knowledge and life experience. We acquire ways and skills at analyzing problems and solving them. And older people are quite adept at tackling complex problems and solving them if they believe they're very important. And they do, from a pro-social goal point of view, believe deeply that the success of future generations is important. So how we can use this unprecedented social capital, how we can enable people to meet their goals collectively when it requires collective solutions, can support the success of young people as they're growing up and as they move into the workplace, and can support the thriving of societies in so many ways. So across all of these pillars of work that and transformations, they apply to all countries in the perspective of the National Academy of Medicine Commission, although the solutions might be developed differently in different countries and regions. All of these solutions need to be coupled with attention, regardless of the stage of development of a country, by solutions for ageism, which adversely affects old people. It also adversely affects young people. With these kinds of approaches, older people will thrive. We will have societies that younger people feel optimistic about growing old in, and younger people will have the support of older people to thrive as well. I don't see any other questions, so I thank you so much for your attention. We're just about out of time, and I wish you a great rest of the day. Take care.